It's another day with your fertility specialist. On behalf of Alps Hospitals, welcome you to another episode today. Thank you for joining. Right now, as we get started, call up someone, share this link with someone. Yes, we are doing a ladies' talk today, even though it's still a big matter that concerns the men, but it's more of ladies' talk. So please, right now, share this link with as many ladies as you can. And if we have the men on this session right now, please share these links with your wives, with your sisters, and also the men. Yes, you're all welcome to watch, because I think a lot of men are dealing with these issues, and maybe they are trying to be, or is it the women now that are sulking in their worries? So whichever way, please call up someone and share this link with someone as we talk about laser vaginal rejuvenation this afternoon. On behalf of our hospitals, we love to say thank you, our dear viewers. Thank you for always staying glued to your screen. You're the reason we're always here for you Wednesdays, Fridays. So thank you so much, viewers. Today we have Dr. Kenneth Eguda with us on this session today. Dr. Ken, it's good to have you. Welcome. So Dr. Ken will be talking about laser vaginal rejuvenation. Oh, ladies talk with Dr. Ken. So please, well, we're sure to have a good time. Drop your thoughts, your comments, your questions in the comment section. We know that vaginal health is something that is of very big importance to women, not just women. Yes, of course, your partners are is something that is also important to them. But as a woman, for your own esteem, yeah, your self-esteem, it's really very vital. So please, this is a very important topic. No matter who you are, this is a topic you shouldn't overlook, you shouldn't downplay, you shouldn't just close your eyes to. So please sit back and enjoy the show. Dr. Ken, once again, you're welcome to this session.
My pleasure.
Yeah. So we're talking about laser vaginal rejuvenation. Well, I'm sure some people might just be wondering what this is all about. So maybe before we talk a lot about it, maybe just give us a hint about what it's about.
Interesting. Yeah, really ladies talk, but I think it's also men talk, just as you rightly said. Laser vaginal rejuvenation. Now, if we decide to use a usual term for it,
Yeah.
or a conventional term that people are used to,
Yeah,
should
yeah.
be vaginal tightening. Laser vaginal tightening. Before now, there are different ways of doing this tightening, or there are some
Yeah.
other ways of doing vaginal tightening. Among those of us who are orthodox gynecologists, we have a surgical way of doing it, where you just cut some skin out of the vagina and oppose the edges, and then you tighten it. It's just like you're reducing the length of a clothes or the width of a cloth so that it fits properly.
Okay.
You understand? Fit whatever it is properly.
Yeah.
So then it takes time to heal. Yeah, but laser now can be used. Okay, we have women who use herbal concoction, hot boiled herbal concoction. It's either they sit just close to it, and the steam or the water itself or whatever it is flows into the vagina and cause tightening, occasionally injuries
Yeah.
that heals with
Burns.
adhesions and scars, and the side effect of all of that. They get all of that effect. But recently,
Yeah.
not too recently, the laser became introduced into the field of vaginal health. And then instead of using the surgeries or the herbal local traditional concoction and heat,
Yeah.
or the use of Kegels, Kegel, which is still very vital, Kegel exercises
Yeah.
to work the vagina or pelvic floor. Now the laser, and there are different kinds of laser. The
okay.
carbon dioxide laser was the first to be introduced for this phenomenon, but now we have a more advanced laser, which is the diode laser.
Laser.
So
Okay.
right here in my hand is a diode laser.
Laser. Okay.
Yeah, the most renewed form of energy for vaginal tightening, and then even beyond vaginal tightening, vaginal health. So putting the two together, vaginal tightening
Yeah.
and vaginal health. Health
Yes.
means improved lubrication, care of infection, care for stress urinary incontinence, increase height of orgasm, maybe clitoral stimulation and all of
Yeah.
that. So when you put all that together, you'll be dealing with vaginal rejuvenation.
Yeah.
So
Okay.
it encompasses the tightening and all these other benefits that we talk about.
Yeah.
So this is in a nutshell what
Vagina.
laser
Vagina
vaginal
rejuvenation.
rejuvenation is. So tightening for those who feel that the vagina is too
It's
loose and the
lax.
husbands are complaining that they don't understand what's going on down there. And for those who are aging and the skin of the vagina or the mucosa of the vagina is secreting less lubricant or no lubricant or dryness,
Yeah.
and thinness of the mucosa, and easy injury, bruisability, and all of that. So
Awesome.
rejuvenation covers
For all that.
all of those things.
So, viewers, having heard all this that Dr. Ken has just listed, I'm sure you're tempted to remain on this live session until we come to the end of this session,
Oh
because
yeah.
there's just a lot for grabs. So please make sure you're getting everything that needs to. And please, the next part we'll be talking about is who needs it, because I'm sure there are some people that have sidelined some people that, okay, these are group of people that really need this, I don't need this. So Dr. Ken will make us know what really even happens to a woman. So maybe every woman at one point or the other might actually get to need this. So we know those people that need it, or let's know if all women actually would eventually need this. Yeah. So what really happens to women? I mean, with respect to maybe their age and the vagina, and then those people that are actually candidates for this vaginal
Okay, so
rejuvenation.
let me start with the area that we don't talk about frequently. What comes to mind easily when you talk about vaginal rejuvenation or
Yeah.
vaginal tightening or laser vaginal rejuvenation is sex. But we're missing a lot by just thinking it's a sex, sexual intercourse, and all the pleasure with
Yeah.
sex. No,
Yeah.
far beyond that.
Beyond
So
that.
we start from the aging women. When women are aging, for instance,
Yeah.
the vagina becomes the mucosa, which is like the skin of the vagina inside,
Yes.
becomes thin. It becomes thin. Then even the muscles in the vagina and the pelvic floor becomes weak and lax. You know, the glands secrete less. And tendency of having infection is there. Then, of course, for those who have had several vaginal deliveries, even cesarean deliveries, sometimes they have what we call the descent of the pelvic organ, the uterus, the bladder, or even the rectum, all the organs that go through the pelvic floor. They begin descent because estrogen is less, the muscles are now shabby or flabby, and then all the aging changes now happens. Now, so women get to a point that these changes happen so bad that they lose control of urine. So it makes it a bit difficult for them to hold urine.
Yeah.
I mean, their continence is compromised. It's so bad that sometimes they cough, and then you have a stain of urine you have a jet of urine on your undies, and it's very embarrassing when you're wearing white. So this is what we call stress urinary incontinence. So occasionally you have this prolapse, whether the uterus is descending or the bladder is pushing its way through the anterior wall of the vagina, or the rectum is pushing its way through the posterior back of the vagina into the vaginal cavity, some degree of it. So this happens with aging or changes that are equivalent to aging in women. That's especially when they've had a lot of trauma to the pelvic floor following childbirth or surgeries or whatever kind of weakness happens there. So now, those people need laser vaginal rejuvenation. the laser vaginal rejuvenation, because just with the use of the laser, I'm talking about diode laser right now
Laser,
because
yeah.
that's what I have right in my hands. They get rejuvenated.
Wow.
Because when you apply that to the vaginal wall, for instance, and allow it to shower the laser light on the vaginal wall, for just 10 to 15 minutes, you improve the blood supply.
Wow.
New blood vessels
Hmm.
are formed.
Okay.
Then you have increased collagen
Hmm.
deposition
Yeah.
on those areas. Then you have an improvement of the glandular functions that will bring in more secretion or lubrication function of the vagina, so
Yeah.
that sex becomes even easier and the health of the vagina becomes improved.
Yeah.
Then early degrees of this prolapse
Yeah.
can be pushed back because the laser activates the myotomes. The myotomes are the muscle cells, okay?
Yeah.
And then the muscles that are lax, toned, or weakened becomes toned again, and that reduce even the caliber of the vagina that is already wide. And then sexual intercourse becomes a little bit becomes improved. Then even infection that has refused to be treated properly because of one reason or the other,
Yeah. Yeah.
sometimes this laser help in reestablishing the bacterial flora in the
Wow.
vagina.
Wow.
And
A
these are the
lot.
things that protect the vagina from infection. So it helps improve the vagina health.
Yeah.
So these categories of people benefit from laser vaginal rejuvenation. When I talked about the stress urinary incontinence, for
Continents. Yeah.
instance, that's the probe for stress urinary incontinence. It's a small
Okay.
probe, you
Wow.
know. This goes into the vagina. I know in the anatomy of the vagina. I guess one day we'll show what the anatomy of the vagina looks like. In the upper part of the vagina,
Yeah.
the anterior part of the vagina, the pipe that transmits urine goes through that part.
Oh.
So press along that angle
Oh.
where the
Okay.
urine comes from.
Wow.
Before now we do all this procedure we call the bulking procedure in gynecology. I'm a trained
Okay.
gynecologist. Before now we do all kinds of procedure to just improve the angle and try to tighten the angle where continence is controlled from, so that a woman will regain continence. But
Yeah.
it's surgically done under anesthesia.
Yeah.
You understand? So this, you don't need anesthesia.
That's true.
Just 10 minutes procedure. Have laser light at the tip of this probe, and it just revolve it or make an in and out movement for 10 to 15 minutes around the
So.
urethra, which is the urine pipe.
Okay.
And then it tones all the muscles around there and restore the anatomy of the urethra and the support of the urethra.
Okay.
And so continence is regained by these women again.
Wow.
So as small as it is, just like a
Exactly. I
metal or
was just going to say
plastic,
that. It
it
looks
does
like a
all this
miracle
big
worker.
job. Yeah, it does all
Yeah.
this big job. Yeah, I'm not saying that this fixes everything. No, because some may have to be corrected by surgery. But at that stage, every woman that has the capacity to tolerate surgery, because it happens with the aging women. And of course, some young girls have this, especially those that have a very bad tear following vaginal delivery. Whether you're 20 or 30, it doesn't matter. You may also need this, but naturally, it happens as women age. So this fixes that, and the health of the vagina is restored, and the woman regains her spark and confidence. Yeah, and then for those that intercourse is painful because of aging, this helps because it makes the mucosa of the vagina thicker, improves lubrication,
Okay.
improve the tone of the pelvic floor,
Yeah.
and even the grip of the vaginal wall, the roughness of the vaginal wall on the penis is improved. And so sex may become actually very welcoming again, because sex may be a nightmare
Nightmare, exactly. They would dread it
to
at
some
every point.
people.
Yeah.
Yeah, especially the women as they're aging. So laser vaginal rejuvenation does this.
So viewers, a lot actually. Pardon me. Yeah, I know that we might have first-time people that are joining us for the first time. You might just be wondering, who is this doctor that is analyzing so much about the vagina? So let me just give you a bit about Dr. Ken. He's a consultant gynecologist. He's a minimal access surgeon. As a matter of fact, he pioneered laser gynecological surgeries in Africa.
Sure,
So
yeah.
now hearing him talk about laser vaginal rejuvenation, you can relate with.
I'm sure if my boss hears you describe me like this, he'll be happy. Because when I underwent my training
Yeah,
from the International School of Laser Gynecology
yeah.
as part of my specialization,
Mm-hmm.
he was like, hey, jokingly, sang and danced. I'm sending
Oh,
you
that's
back
so
to
sweet.
Africa to go and start laser surgery, laser gynecological surgeries in
Surgeries,
Africa. Oh,
wow,
yeah. So
wow.
when you say that, yeah, it actually strikes a bell. It was like play, but
Yeah, it's
it's
happening
happening
already.
already.
Yeah, it's
Right?
happening already. So I hope a lot more about him, but I thought to draw this to your attention because I know I didn't talk about it, and some people that are joining for the first time might just be wondering, where's this doctor talking? And yeah, that's just a bit about Dr. Ken. So back to laser vaginal rejuvenation.
Mhm.
So I know that what's your thoughts with respect to those people that give birth? When will you recommend vaginal rejuvenation for a woman that has given birth? When is it best? When is it best for them? Yes, to have a session.
Yeah, I like the dimension you're going, because the subject of laser or vaginal rejuvenation always is always said with respect to intercourse,
Mm,
but then there's a lot more to laser vaginal
exactly.
or to vaginal rejuvenation beyond intercourse.
Yeah.
Now, you talk about childbirth. Just 2 years ago,
Yeah.
there is a global recommendation
Okay. Hmm.
that a woman should have, if possible, a session of laser vaginal
Rejuvenation.
rejuvenation
Hmm.
after vaginal birth.
Oh
And then
wow.
some went ahead to say even after cesarean delivery,
Delivery. Wow.
because the
Hmm.
body undergoes or
A
underwent
lot of
all the changes.
changes.
Just that in
Yes.
CS delivery, the baby didn't come
Come
out
on
from the
through
vagina. But
there.
let's look
Yeah.
at the vaginal delivery. You know, the head of a baby is quite big
Hmm.
compared to the vaginal caliber.
Yes, that's true.
The vaginal canal, when blind, I mean, when nothing is going through it,
Yes.
is a blind space. And at best, it's just about 3 to 4 centimeters wide.
Hmm.
But now you have a 10
Centimeter.
centimeters head
Hmm.
of a baby. And some
Hmm.
babies have very big
Big.
heads.
Oh God.
Yeah, some babies have very big heads. And some
Very
babies have
true.
very wide shoulders.
Shoulders, yes.
All those bulky babies, well fed mothers' babies.
Oh yeah.
Yeah, and all this goes through the vagina.
Yeah. Oh, so
Sometimes when you're taking a
traumatizing.
delivery, you kind of feel that this
Oh
vagina is
goodness. It's
going
going
to
to
rupture.
oh good.
And sometimes
Wow.
you're trying to save not giving a cut, and
Still.
then the vagina tears
Yes.
itself out and the baby
Yes.
comes out and the woman feels improved and better. Then her problem starts.
Starts.
You know.
Problem
So
starts
when
really.
this head goes or the baby goes through this canal,
Yeah.
it stretches this canal to a very large extent, unbearable length or width. And then there are lots of damages that happen to the muscle cells. And some women never recover.
From it. Absolutely
And
true.
then that's when locally we hear that husbands are complaining. Some women say as soon as they give birth, their
My husband
husbands
exactly.
doesn't find
Not
interest in
interested.
those stuff anymore. You
That's
know,
true.
now some don't just even give birth. Some have tears, and some have organized tears, organized cuts that we give called episiotomies.
Yeah.
So we fix it afterwards. Whatever kind of tear it is fixed. And
Yes.
sometimes these tears are so bad that the rectum is affected.
It's true.
The sphincters of the rectum and anus is affected.
Yes.
And
Absolutely.
even the rectum sometimes can be torn. We have third and fourth degree tears.
Gosh. But
So now you repair. But
yes.
then he's recommended that with or without the tears, a woman should have a session after vaginal birth.
Birth.
But usually it is after the puerperal period. That's
Period.
after 6 weeks
6 weeks.
when she has
Okay.
stopped having all
Discharge.
what we call look. Yeah, I don't know
Yeah.
what to call
Yeah.
it now in local language. Yeah,
Whatever discharge she
all
has.
those birth discharge.
Yeah.
She should have a session because it helps in the healing of the muscles. It activates the muscles and returns the tone of the muscles. And then the pelvic floor gets itself back,
Back.
and the vagina can go back to its caliber. Then the mucosa that will have been damaged, all the
Yes.
bruises, also become better. The glandular activities return. That's what laser does.
Wow.
When you do that, surgery doesn't fix that. Because at that
Absolutely,
point, what you need
exactly.
is to have a restoration of the physiological function and anatomical structure of the vagina. So
Yes.
surgery doesn't fix that at that point in time. So when a woman has that, she gets better and get her
Yes.
spark back, get her sexual function
Exactly.
back,
It's
and
true.
it prevents her from having a risk. It reduces rather the risk of having prolapse later.
Later, wow.
Yes, so that's the benefit of it, because you see, prolapse, uterovaginal prolapse, are
Yeah.
a consequence of vaginal deliveries,
Wow.
the number of vaginal deliveries. So
Deliveries.
after the puerperal period following
Mm.
delivery, a woman is advised to have a laser vaginal rejuvenation. Yes, this is not a common talk in public domain,
It's true.
because in this
That's
part of
true.
the world we are still battling with how to get safe motherhood,
And all
safe
that.
delivery, and all of that.
Yeah,
And then we're
yeah.
talking aesthetics of care of
Exactly.
mothers after delivery. So, laser vaginal rejuvenation is recommended after childbirth.
Speaking of this, a lot of cosmetic, should they do they call them? Is it anesthetic? No, that's anesthesia.
Aesthetic.
Aesthetic.
Uh-huh.
Thank you so much. You have a lot of these clinics now considering vaginal rejuvenation, and then you now wonder. So this is something that really bothers women, and then yet they seem to shy away from talking about it. But then you wonder that you see a lot of them trooping for these procedures, and then you're like, okay, so this is something that's really been bothering you guys,
Oh
and then
yeah.
the society that will find ourselves doesn't seem to allow women express themselves or not even talk about it. It makes her feel like, okay, is this your problem? There are other things to talk about and not this. But it's about the woman's self esteem. A lot of things actually make up your self esteem as a woman, and that's why you shouldn't shy away from this part. This is one of them that makes up your self-esteem aside other things. So you shouldn't deal with others and then abandon one. You are a whole being, and then everything needs to be whole. So whatever it takes to make sure that every part of you is whole, and I think it's something you should go for. Well, speaking of the surgical means you talked about, maybe we should do a bit of comparison as to what that one does and the advantage of this over that.
Oh yeah. You see, right from my days of residency,
Yeah.
then becoming a specialist and sub-specialization in whichever field interests me.
Yeah.
And by the way, I'm considering changing my field because I'm heading towards genetic medicine.
Okay.
Yeah, we do the local surgical repairs,
Yeah.
because that was what was available those days when we were resident doctors. You know, the women, especially those of the northern inclinations,
Yeah.
come and their partners are complaining the vaginal
No,
is too
that's
wide and he doesn't know
yes.
where he finds himself.
So
So what we do then is to cut the mucosa of the vagina, just like the skin inside of the vagina, and reoppose the edges.
yeah.
We do that under anesthesia. And then, okay, imagine you're getting an anesthesia, occasionally, often spinal anesthesia, which is a regional anesthesia. Then you're caught with scalpel in the operating room. Then we carry out the procedure,
Yeah.
which may take an hour or two. Then when you recover, you heal with a scar.
That's true.
You heal with a scar, and the scar can interfere with your pleasure or with the pleasure of sexual intercourse.
Yeah.
Then you see battle with dryness, because the surgical repair doesn't have anything to do with dryness. You may have to use lubricants, artificial lubricants,
Exactly.
during intercourse to make it smooth and prevent bruises and injuries. It doesn't have anything to do with infection prevention. And then you only will return into, having intimacy or sexual intercourse maybe 3 to 4 months after,
After wow.
because it take a while for that healing
Exactly
to
to
really
happen.
occur.
Yeah.
So, but then with laser,
Yeah.
you know, you don't need anesthesia. You don't need anesthesia. You can actually just come from your office
Oh, okay.
to if when planned, come to the office, to the clinic.
Yeah.
You don't need operating room. It can be done
Wow.
right in the consulting room.
Okay.
You understand?
Yeah.
Just 10 to 15 minutes. So
Wow.
now this is now the laser
Yes.
itself,
Yeah.
and this cord is connected to the laser generator
Yeah.
machine, and this is a diode laser. It's just a lights, no showers unnecessarily, controlled
Yeah.
lights at the tip, and then you just insert it to the vagina.
Wow.
I actually don't even do it anymore. The nurses in the facility do all these
Wow,
procedures
wow, that's
because
impressive.
in my own facility, all the nurses are trained. I
Wow.
mean, the laser nurses are
Yeah,
trained,
yeah.
so all they need to have this connected and have the
Yes.
machine program to
Yeah.
deliver at intervals, and then with
Yes.
this in the vagina,
Out
in and out, all along the length
of
and
the
depth of the
vagina.
vagina and the width of the vagina is showering laser. And by the time you're done, 15 minutes, you find the caliber reducing in its size.
Yeah.
It becomes narrower. That's to say, it becomes tighter.
Yeah.
Then, in
It's
addition to
true.
that, new blood vessels
Wow.
are beginning to form.
Exactly.
Collagen deposition is improved. Reticulin fibers are improved, and all of that. And then, very interesting. Sometimes the vulva of the vagina may look unhealthy. I
Oh,
mean, there are some vulva that look
the appearance.
appearance look intimidating. Sometimes it looks intimidating.
Yeah.
So we have another probe that can be used on the
Wow.
vulva, and it makes
Okay.
the vulva
Looks
tidy
better. Wow.
and makes it look sleek.
Hmm.
So um this is just 10 to 15 minutes all I've discussed.
If you asked me, every woman, this is a go-to technology.
No pain relief is
Yeah.
needed because the
Yeah.
warmth it dissipates. It's just about this the warmth of a cup of tea
Wow.
that you
She's
can
tolerate
tolerate by sipping.
exactly.
And she feels no pain. She
Exactly.
dresses up and get back to the office.
Hmm.
If she has some discomfort, maybe not 1 or 2 days, an intercourse can resume the next fourth day.
Wow.
Oh yeah, as
That's
against surgical
yeah,
intervention where you have
yeah.
3 months
Hmm.
pain and all of that
Wow.
discomfort, pain relief and relief and relief before all of that.
Mhm.
Then the benefit is just enormous. Yes,
Yes,
and I'm
it's
not just saying it
enormous.
because that's part of what I do, but it's just laser.
Yes.
That's just
We've
laser.
at least I'm sure that over time people that have accessed this have actually seen the benefits, and they recommend it for people that have had the experience. So for every woman watching right there, do not be shy of coming to seek this technology. It's for your, yeah, it's for your health. It's not just about sex. It's not just about, yes, of course, when you have a partner and all of that, of course satisfaction is paramount and all of that, but for your health as well. I mean, Dr. Ken has made us understand how it could reduce the risk of infection for those people that have their floras already tampered with, and also a lot. There's just a lot to gain with this. I'm sure there are some people that are also wondering how many sessions would they need to have. Is one session just enough and all
Okay,
of
so
that?
for those having a childbirth, for
Yeah.
instance, just a session or two is okay. One
Okay.
session is just adequate, especially for the younger folks,
Mm.
But for those having menopausal changes, we
Mm.
usually recommend 3 sessions, a session per month, and each session just lasts about 10 to 15 minutes,
Mm. Wow.
yes, and then a session yearly.
Okay.
Yes, afterwards,
Okay.
because you need those areas to be activated. And of course, if you're good enough and have the energy to also continue with Kegels exercise and all of that, then of course
It
it
makes it
helps
better.
even more.
Mm.
So, but then you need to be reviewed first by the gynecologist and see what kind of, because there are sometimes you need some surgical intervention,
Intervention.
before laser
Okay. It's
laser repair is done. And even for those who have episiotomy repair, for instance, the laser rejuvenation helps in improving the scar
oh,
of the episiotomy. Yeah,
wow.
that's a cut in the
Yeah,
vagina at
yeah.
childbirth. So it makes it even better. So look at antenatal or postnatal care getting improved with the help of the laser.
Wow.
This is a diode
It's a
laser.
lot.
Yeah, a specific diode laser. This is not carbon dioxide laser, diode
Yeah.
laser. So it helps a lot. So 3 sessions for the postmenopausal or
Women.
perimenopausal women who
Women.
are already undergoing the age changes related to
Yeah.
the vagina, and maybe 1 session. If they need more than 1 session after birth, the doctor is going to give an
Let them
advice,
know.
you
Yeah.
know, and yeah, that's it.
So
So that's the number of sessions.
and that's why even after one session, it's good for you to give your feedback to your
There's an aspect that we need to talk about.
yeah.
As gynecologists, we do a lot of hysterectomy, for instance,
Mm.
following prolapse. You know, After prolapse, hysterectomy, yes, takes out the uterus as it's descending,
Uterus.
but the vagina
Yes.
will still stay lax,
Yeah.
loose, and
True.
unhealthy.
It's true.
They need laser rejuvenation. Then you have a good number of women who probably have a leakage of urine after delivery because of
Yes.
what do you call this now? Vesico-vaginal fistula.
Mm.
Labor that is not properly managed, and then you have
Yes.
damage to the structure between the uterus and the bladder, and then the bladder begins to leak urine continuously.
Wow.
So usually you have the VVF doctors, who are specialists in pelvic surgery,
Yeah.
repair all of these structures. But then you just manage to
Totally
get
repair.
healthy tissues to repair.
Exactly. Yeah.
After repair, successful repair of a vesico-vaginal fistula,
Fistula.
you
Yes.
need laser therapy, because the laser therapy helps to rejuvenate the myocytes, the mucosa, the skin covering around the area of repair.
Oh, wow.
Yes, because sometimes you repair these tissues, and tissues around there are not very healthy tissues.
Yeah.
And in addition to that, you may even need the stem cell rejuvenation, the PRP rejuvenation alongside this laser rejuvenation to make a woman really get rehabilitated back to herself. So there are a lot of areas that laser can get application. Sex is one big
One of
one.
them. Yes.
Yes, but the health of the vagina is even bigger, if you ask me.
Exactly. Yes,
Yeah.
because there's just a lot. I mean, there's a lot that Dr. Ken has mentioned with respect to the benefit of this. It's not just about the sex part. Your health. If you keep having recurrent infection and this is the way out, why not?
Yeah.
It's a welcome deal
Yeah.
for you. And then leakage of urine, if this would improve it, why not?
Why
It's
not?
a way
Yeah.
out for you. Painful sex and all that, and it would improve it in a way. Why not? It's a go-to for you. But also, are there people that are contraindicated from having this? Like, is there a contraindication, or is there a side effect to this procedure or no?
On my TikTok page, a lot of
Yeah.
ladies actually ask whether there are side
Effects,
effects.
exactly.
You know, for laser vaginal rejuvenation, there are no side effects.
Okay.
This sounds too
Too good
glorious
to
to
be
be
true.
accepted,
Yeah.
but that's just it. If at all there are side effects, maybe just little discomfort because of warmth, and maybe a little discharge after the procedure.
Procedure.
Yeah,
Okay.
if you consider this side effect. But side effect as in causing cancer. One person particularly
Oh my
asked whether it causes
goodness.
cancer. There is no evidence that it causes cancer. It
Cancer.
does not cause cancer. Well, with the level of
Information
information
available.
we have right now, it doesn't cause cancer.
Cancer.
These are stuff that stimulates cells to become healthy.
Healthy.
Stimulate even the
Exactly.
ovaries sometimes. Some lasers stimulate the
Yeah.
ovaries to produce healthier eggs. So,
Wow.
as in causing cancer, it's not a fear that people should
Should
have.
have.
And then we don't have anything that we could say side effect. Yeah, laser could burn if you overexpose an individual to
To
it,
it.
but not when you have a controlled setting. The only
Exactly.
areas where I see laser having side effects, yeah, if you're performing a surgery, yeah, I do uterine surgeries with laser because it's the safest energy to be used on the womb, on the
Yeah.
uterus. And sometimes it could be so hot that it could cut beyond the level you want to cut. You could traumatize the uterus, cutting beyond the region of interest. Yeah, that could be a side effect, you know. But for vaginal rejuvenation,
Rejuvenation.
it doesn't cause cancer. Side effect is either not there, or if at
Very
all,
minimal.
very minimal. So it's not anything for fear. But if any of the listeners know of any side effect, you could tell, because we're learning every day. But
Exactly.
this has
So
no
viewers, you really don't
feared
have.
side effects.
So there's really nothing to fear from all that we've seen. Really, do not allow whatever it's. People have their people are entitled to their opinions, and sometimes when they want to scare some people away from it, hearing laser, and then they just feel it's just something very big and something that could terrify. We don't know what could happen and all of that. Please, all those once you don't have an evidence to what you're saying, you can't say this is what it will cause. And
Occasionally, when we're using laser, like for aesthetic surgeries,
yeah.
sometimes you have these Europeans who have a lot of skin lesions.
Okay.
Skin lesions, tags, yeah, tags. I don't know. I'm not a cosmetologist, but some tags or some growths on the face, on the skin, and makes the skin
Patches.
very patches, that make the skin molds, that make the
Yeah.
skin very unhealthy. And now you want to operate around the face.
Okay.
So then you're not going to be using this kind of laser probe.
Yeah.
Use a laser pen
Oh,
with a
okay.
bare laser fiber. Maybe sometimes I'm going to do some exposure in my operating room so people could see where I work
Okay.
and how the work goes.
Yeah.
So now, because we're going to be working close to the eyes and the face
Yeah.
with a bare laser fiber, which is like you're working with an electric wire,
Yeah.
that is not protected. This is protected,
Exactly.
insulated.
Mm.
That is not insulated. So this individual wears a laser goggle,
Oh, okay.
yes, to protect the eyes, because
Oh,
close to the eyes, bare fiber could cause
yes.
some damage to the
To the
eyes. And
eyes.
even we who are operators also cover our eyes,
Mm.
yeah, because it could affect the eyes. That way, yeah, laser could have effect. And if you're operating, let's say around the pubic or perineal area, you're dealing with warts, because laser treats vulvar warts
Mm.
or perineal warts for men and
Oh,
women like mad. That is the
wow.
most effective treatment for warts.
I'm sure
And it
someone is
turns the
taking these
skin
notes. Mm.
to baby skin.
Okay.
Oh
Wow.
yeah. Yes.
Ladies that love baby skin.
Beyond the use of um, podophyllene gel or podophyllene cream or
Yeah.
something, which is
Yeah.
very hot and painful, you know, you need to see the healing effect when laser is used. So when we're working with bare fibers, we all use glasses because
Protect.
it can affect the eyes. But for vaginal rejuvenation,
Rejuvenation.
no, it's protected. This is double insulated, insulated,
Insulated.
so it doesn't
So
do
you're not
side
having
effects.
direct
Yeah.
contact with the fiber. Exactly.
Exactly.
So
Yeah.
that's all we're talking about, the side effects. Really, it's almost not
It's
there.
almost not
It's
there.
almost not there. So you have a question coming from Ben from Facebook. Say, I love this topic. Another one is saying, Helen is asking, at what age should they consider having a vaginal rejuvenation? That's Helen asking also from Facebook.
And then at any age,
Mm,
if you have a partner who is complaining at any age, you do it at any age.
mm.
If his complaint is important to both of
Yeah.
you, you could do it at any age. If you're delivering at any age, vaginal delivery especially, you could have it at that age you're delivering. Then if you have trauma to the pelvic floor and it is fixed, you need the laser to make it heal. So it's not just for sexual intercourse. Then if you have
Exactly.
delivered and the vaginal is wide and your
Yeah.
partner feels he's swimming in an ocean, as somebody puts it,
Yeah.
you could have laser vaginal rejuvenation and not necessarily surgical. So there's no age
To
limit.
it.
And you could be advanced age, not necessarily for sex, and your vagina feels unhealthy. Yeah.
Exactly. I've heard of a young lady that complained that she feels like her vagina is too loose, and of course, yeah, she met one of the gynecologists at the facility and was recommended to have a session. Of course, she did, and she felt a lot better. So that's for a young lady, and
You remember there was a case we did.
mm,
We did a case, was it last year or some months ago?
okay,
We used a particular caliber of laser.
Mm.
After a session, we're going for a second. Within that same session, for some reason,
yes,
the probe came out of the vagina,
yeah,
and we're
and
trying to insert it back,
and
and it couldn't go in
felt
again because it was
it
already too
felt
tight.
tighter. Yeah,
It was already
exactly.
too tight.
Mm.
So
So that
the
is it's
changes can
almost
be
like
drastic.
magic, yes.
Can
And
be
for some
drastic
people,
sometimes.
and that I know someone that did one. Why is my own not working out? One
That's
said,
true,
so that's for everyone. Well, even though this person is asking a question outside this topic, is there a surgery like ovarian rejuvenation? Stella asking
Oh
Stella
yeah, there is
normally.
ovarian rejuvenation. We
Mm,
do that a lot, but using the
okay.
precursor stem cells
Mm,
or the platelet-rich plasma or adipocytes and
okay.
all of that. So yes, it's not a surgery per se. It's a
Mm,
procedure. I prefer to call it procedure
procedure.
because you're not caught in the operating room. It's a
Exactly.
special way of doing it. Oh yeah,
So Stella,
there
I hope
is.
that answers your
And
question.
it's recommended for those who, for some weird reason, will not want to accept egg donation or who have run out of time and they still want to try to
Try
use
to
their eggs to achieve pregnancy.
pregnancy.
And then they can have a session or three, and then they could have spontaneous conception.
Conception. Wow.
Yeah,
So
if conditions are right for spontaneous conception,
conception to
we do that a
happen.
lot.
Mm.
Yeah.
So hope that answers your question, Stella. Of course, yes, there is, like Dr. Kenneth said. So well, with respect to vaginal rejuvenation, what's your would I say counsel now? Yes. Talk to the women with respect to this because they've heard a lot about why this is necessary. But what's your general counsel to them with respect to
It's
this
not painful.
procedure? Yeah. Yes, that's a regular question. Is it
It's not
painful?
painful. Yeah, it's not painful because this is a probe, for instance.
Yeah.
Forget the fact that I'm playing with the probe. This probe is like 2.5 centimeters wide. The vagina is about 3 to 4 centimeters
Yeah,
wide.
yeah.
It's not painful. So it's not even wider than an erected penis.
And maybe if the camera is magnifying it, it's not as big.
Uh, this is
Just in
this is
case.
this is like 6 to 7 inches.
Yeah.
And then it's about 2.5 to 3, 2.5 cm wide, and this just goes in and out of the vagina.
So I'm a
You
woman and
understand?
I'm
So it's
saying
not
it is
painful
not
at
big.
all. It's not painful.
Yeah.
It's just like you're doing an ultrasound scan with a transvaginal probe. Oh
Oh,
yes,
yeah. I
exactly. So it's
see.
almost the width
Okay.
of some transvaginal probe. So it's
Okay.
just not painful. It's
That's a
not painful
perfect
at all.
description.
It is not painful. It's quite friendly. It's quite friendly. Yeah, it's not painful. And I know the highlight for me is the fact that you can just come into the clinic as a guest.
Yes.
Maybe use your break time from work and have it done within 10 minutes, 15 minutes, and you get back to work if your break is 30 minutes.
Yeah, I know of a banker that had to take a little break. She just came. Sorry, I'm going back to work. Then she just came
So,
and that was it. And she was back to work like
oh
nothing
yeah,
happened.
so that's how it is. It's just not painful. Guys are always worried whether, okay, now if you've taken an intramuscular injection
Injection.
before,
Yeah.
it's 100 times more painful
Painful.
than this. Yeah, if you've taken an injection on the
Exactly.
buttocks or in your
Yeah,
arm,
or
it is
exactly.
100 times more painful than
So
this.
injection is more painful than it's more painful
Oh yeah.
than this. So this is if that's what is pain, then this is no pain at all.
Yeah, and if you've had a pap smear done, it's more uncomfortable than this.
Wow. So you see a lot of instances to let
Oh
you know that
yeah,
there's really no pain
exactly. So
to
it's not
this.
painful. It's
Thank you
quite
so much,
friendly. Yeah.
Dr. Ken, for this enlightening session. Viewers, I know you had a good time, and I'm sure that would have a lot of you coming to seek this service because it's something that is very important. It's something that cannot be overemphasized. It's very, very necessary for every woman out there. You actually get to need it at one point or the other, and that's why you shouldn't discourage someone that's trying to get it now because you also do not know when your time would come that you would need it. So please do not be shy. Do not be ashamed to seek this help. Just make sure you're getting it from the right place where you're sure of what you're getting. And we hope that your vaginal health is restored as soon as possible once you seek this. Should I say help now or this miracle that has come to stay?
This intervention.
Oh yeah, this intervention. Better put this intervention has actually been very helpful to a lot of women. So please, why stay and go through all you're dealing with when you could actually just feel a lot better by a very minimal procedure that is very short, painless, and all of that. So please, we look forward to
But it's not
seeing.
free.
Oh yeah, yeah. Oh yes, of course it's not free. You can't be accessing service anywhere. Like I mean, service of this sort and expect it to be free.
It's
So
not free.
it's not free, but it's affordable. So of course, please, we look forward to seeing more of you coming to access this service either here or a center in Abuja. Yeah, you could get all of this done. For now, I would love to say we had a good time with you, our viewers. That Ken, we also had a good time with you. Thank you. It was a nice outing. Please continue to stay tuned. Continue to look forward to all our notifications on our various handles so you'll get the latest information because we're always up to date with information. But for now, we'll see you on our next session. And yeah, more of you than today. Bye for now.